In the past couple of weeks, Presiden Joko Widodo has been visiting some areas around the country to monitor the mass vaccination program. During visits, the President highlighted one important message.
Untuk nanti di akhir Agustus, target 7,5 juta penduduk di Jakarta harus sudah tervaksinasi. Ini memang target yang sangat ambisius, tetapi mau tidak mau kita harus menuju ke sana untuk mencapai kekebalan komunal, herd immunity. Target kita paling tidak di Kabupaten Bogor ini bulan Agustus itu sudah tercapai kekebalan komunal.
To reach herd immunity, Indonesia needs to inoculate 180 million of the people. But the invitation to get vaccinated usually follows with a question: which vaccine will I get? This is what the COVID-19 vaccine from Sinovac looked like. And this is what the COVID-19 vaccine from AstraZeneca looked like. From the appearance, both of these vaccines look pretty much the same. But people has been talking about efficacy rate and the side effect of each vaccine. First, let's talk about efficacy rate. A vaccine's efficacy rate is measured by looking at the difference in new cases of the disease between the group receiving a placebo and the group receiving the experimental vaccine. But Sinovac trial will take a different time, place, and inclusion criteria from AstraZeneca. So it's not really an apple-to-apple comparison. Oh, and the efficacy rate doesn't determine the effectiveness of a vaccine. A vaccine's effectiveness describes how well it protects people in the community outside a carefully controlled clinical trial. Like one research that was conducted from January up to March 2021 by the Indonesian Ministry of Health. It shows vaccines' effectiveness in protecting more than 128,000 health workers in Jakarta.
Dari penelitian ini bahwa sebetulnya pemberian vaksinasi dosis lengkap itu secara signifikan dapat menurunkan risiko dan mencegah COVID-19 bergejala bahkan hingga hari ke-63 dan juga dapat menurunkan risiko perawatan dan kematian karena COVID sampai 98%.
While a study on more than 23,000 people that had received their AstraZeneca jab showed a good result as well.
Hasil evaluasi KASIAT menunjukkan bahwa pada pemberian vaksin AstraZeneca dapat merangsang pembentukan antibodi baik pada populasi dewasa maupun lansia. Rata titer antibodi atau geometric mean titer setelah dosis kedua dewasa sebanyak 32 kali dan pada lansia di atas 65 tahun sebanyak 21 kali.
But how about side effects? This has been a main concern for many that hold them to step in line for vaccination.
Biasa kalau kita mendapat obat atau kemudian mendapat injeksi, kan ada apa signifikan, apa rasa nyeri, atau demam, atau menggigil, itu non-serius.
So what the sore and fever that you feel after the jab? That is very normal. But getting vaccinated alone is not enough. It's not a golden ticket for us to escape the reality that we are still in the middle of a pandemic. Three W. I know, you've heard about this 100 times. Wear a mask, wash your hand, and watch your distance. But do you really obey these rules? And do you understand how important this is in preventing the spread of coronavirus?
Jangan sampai program vaksinasi yang sudah berjalan, program PPKM mikro yang sudah berjalan, yang sudah bisa menurunkan konfirmasi kasus COVID-19 selama ini, membuat kita menjadi tidak waspada. membuat kita menjadi tidak hati-hati. Karena lonjakan bisa terjadi lagi. Dan alangkah sedihnya kalau usaha keras kita selama ini jadi sia-sia.
So yeah, don't be selfish. By following the 3W, you are not only protecting yourself from the virus around you, but you also protecting others. Because you might carry around the virus and you don't even know. And if you haven't get vaccinated yet, why don't you take a step closer to end the pandemic? Rebecca Napitupulu, Anita Putri for See Today.